waste a lot of time. I want to bring to our attention, I am a Muslim by religion and a holy one at that. I want to confirm to all of us here, a mad person, a true mad person does not sneeze. Yes, it does not sneeze, does not smell a bad thing or a good thing. Azobiniriku, ngoneko. But I want to bring our attention to this town that each and every
please.
mad person.
Do you have something to put forward? Let's hear it. Sorry, Speaker, you continue.
It's okay.
1 minute. You're giving a point. I thought it was a point of information. And then you have to direct it. Thank you. Thank you, thank you. Thanks for that point of information. Before the speaker goes on, I would wish to make it clear that he mentioned it clearly, that he mentioned his religion not because it causes that. He mentioned it as a point of reference.
Procedure, Madam Speaker.
Please continue. It is just a point of... Yes, please.
Procedure.
Let me have the procedure.
Thank you, Madam Speaker. I just wanted to say, is it right for the honorable colleague to affirm to us that in his docket of being a faithful, the mad person does not sense of smell and any other thing? Are we proceeding well to this effect?
Thank you so much for that information. And to that, I would you want to respond before I say something?
Yes.
Please go ahead.
Madam Speaker, had not brought issue of religion here. I was trying to tell that if, like I said, I am a holy one, if you read the books, Bible or the Quran, the first prophet was Noah. In his regime, he stayed for over 950 years.
Make it brief.
And he stated clear, a mad person does not sneeze, does not breathe or smell a very good thing or a bad one. And that is to say, I was referring to, that means our young people who are mentally disturbed in town, most of them, these are challenges of issues that we are raising right now. Because if you move around, you'll find a mad person in town who is sneezing. Now, if you go through the Bible or the Quran, you will find that a mad person does not sneeze. What could be the problem of this young person?
Thank you so much for that. Please, this is not up for debate.
I
would...
let me leave away with that. Madam Speaker.
Hold on. Now, I would wish to make it clear to the room that it was a point of reference. It's just like you can use a biology textbook to refer to something. So let's not make it a point of argument. Let's go to the matters at hand. Thank you so much. Please continue.
Thank you, Madam Speaker, for defending me. I believe I am safe.
I'm not defending.
And regarding to that, as the previous honorable member had said earlier, I think the two motions, the first one and this one, are not different. So it goes back to a way that we should have. I will encourage we should have a rehabilitation center in this region. Because if you take I'm winding up, Madam Speaker. My time was exhausted by other colleagues.
You've used 1 minute. Continue. You have 2 minutes.
Okay. We should have a rehabilitation center in this town. And the ordinances or the bylaws of using substance should be there. And another thing is, let's encourage parental care, because some of the issues, the stress which are coming, which are causing mental health, are coming right from our homes. You'll be paid in school, but you'll never be given money or capital for starting a business. So such things comes. But my prayer is that let's engage in a good relationship. It helps health-wise. It is okay. And we should have a rehabilitation center in this region. And let's do peer-to-peer advisor ways of doing things to help. Thank you.
Thank you for that. You?
Thank you, Right Honorable Speaker. I just want to submit on to this matter.
And after you submit, please do submit.
It was not proper for our colleague to mislead us that.
Thank you. I said that was not up for debate. Please move on.
Thank you, Speaker, for your guidance. My submission is, mental health is not only caused by drug abuse, it is caused by oppression, negativity, maybe use of negative words, inadequate financial support from parents, even within. When you're working and you're not paid, you will mentally be stressed and psychologically you are not upright. So, for that matter, I will have to pray. My prayer is, those who are employing, they should make sure that they pay their employees timely. And then, my second prayer is for the government to make sure that whatever job they are bringing, whatever innovations they are bringing for the youth or for any other person in this country, at least there should be fairness in administering all these finances. The PDM that we are talking of, the process is very long, and I have been involved in one of the registration process.
Please wind up.
I am concluding by saying, Madam Speaker, to me, from now on, let government give interest-free loans to youth, regardless of where they are coming from, regardless of their background. I beg to submit.
Thank you. Yes, please.
Thank you very much for this opportunity. Mine is just a submission based on our upbringing from our backgrounds. I believe that all of us have religions that we grew up in. And what I'm suggesting is that these religious leaders can help us to talk to this youth in churches or maybe mosques. Let them sensitize them as we are moving on with preaching the word. Can't we also talk to them about other things in different faiths? Someone can be a Catholic, another person can be a Muslim, another one can be an Anglican. So I was calling upon the government, if they can help us talk to these religious leaders and they can curb them in another way through the religion. Thank you so much.
Thank you for that. Yes, please.
So many factors that influences the issues of mental health. Now, my prayer one is through the local governments.
Excuse me. Can we have some order here? Please continue.
Thank you. My prayer one is through the local governments in the office of the labor office. There need to be specific engagement with the employers, maybe the relevant authorities, looking at the issue of stress that the employees are having, the young people who are employed, about the issue of low pay, delayed pay, or not even completely no pay. I think there's a specific initiative that the local governments need to take to engage these the employers to see that such issues are addressed. Number two is to the district education officers. We need to move to schools and put a base to address mental health issues in schools. We cannot always come out and address give the solutions, but not looking into the challenges, the main factors causing these mental health issues. So many people are not
Please
mentally
wind
okay.
up.
Yeah, so many people are not mentally okay. But now we have not asked the question, what causes that? I think we need to go to the base of that, and that is through the schools and other sectors. Lastly is through the police. We have the whole department of the community liaison office, and sometimes they face challenge because of finance issues, resources,
That time is
but I
up.
think that needs to be addressed through the officers as well. Thank you.
Thank you. Yes, please.
Thank you so much, Madam Speaker. Once again, I am Honorable Twalib Ayub Ali. When we talk about mental health, this is a very, very sensitive and important point that we should be interesting ourselves in strengthening the systems as we are agreeing today. These challenges, you will realize that they are not visible, but you realize that they are there. Therefore, you will realize that these challenges normally come in because of discrimination, because of stigmatization, because of lack of jobs, because of lack of accessibility. That, of course, contributes to the mental health of our young people. You will realize that the young people are suffering quietly, but you will understand that this is an issue that is killing them quietly. Yeah, so I really want to bring the point of persons with the hearing impairment. If I can confirm to you that Arua, the psychiatry unit, as far as its accessibility is concerned, it has no sign language interpreter that would support a deaf person access these other services there. And I don't know how this can be handled. I don't know how this can be handled. You realize that there are challenges that the youth
Speaker,
himself.
wind up.
Okay, thank you so much. My prayer is that let the government, the private sector, and the CSOs ensure that we should focus in empowering this. Empowering the community, empowering the parents to offer them sign language to ensure that their services at the psychiatry unit is accessible for our youths with hearing impairment. Thank you so much.
Thank you. Before I pick... Yes, please. Thank you. Thank you so much for that point of information, but I would want you to take back the part where you said someone is giving nonsense, because I believe each and everyone's opinion here is very important. So I'm not going to be biased and give other people more time and give others less. If we agree it's 2 minutes, let's keep it to 2 minutes. If you say the time is not enough, then we can agree and just increase on the time.
Madam.
Not really saying other people should know. That's not right.
Point of order.
Yes? Thank you for that.
Point of
Before
order,
you,
right, Honorable
yes,
Speaker?
let's have the point of order. Who is talking?
Honorable colleague,
Yes, please.
I, Honorable Lemarco Ernest. Honorable colleagues, is the Honorable in order to tell us that we should not deliberate on time, but proceed? Are you in order in that effect?
Thank you so much. As I mentioned earlier on, I said if we are you saying me or be specific? We are all honorables here, right?
I could address you, Honorable Speaker.
Thank
but
you.
if it was not for you, that's why I say the Honorable colleague. It means it is this side. Is he in order to tell us that we should just deliberate on matters without time frame?
Thank
is he in
you.
order?
Thank you. So now, let's have order, please. Overruled. Overruled. Thank you so much. I would want to make this clear. Overruled. Allow me speak. As I mentioned earlier on, there is always a specific time allocation that is given. Now, if we are going to say we just allow people speak, are we going to stay here until what time? That is not right, because everyone... Thank you so much. And then that is an error that we'll have to work on, right? So that next time we have a specific time duration, that each speaker will be given this specific time, so that when time is up, time is up. Are we right? And you have the floor to ask the speaker for more time. No one has asked me for that. Are you blaming me for that? No one asks. If you ask for 1 more minute or to finish up, I've not denied anyone, but no one has asked for it. You need to advocate for what you want as youth. Thank you. So, with that, before I continue, we have someone who wants to deliberate with us. We'll give them the opportunity to speak online before we move to the next deliberation. Thank you. He has gone on? Okay. As we wait for him to get back online, we are going to take other 2 hands so that we summarize. Yes? Yes, please.
My submission is that for us to address this matter, we need to integrate mental health into primary health care, whereby training staff to cover lower levels like health centers. This is to the Ministry of Health, that with the numbers of cases, they need to work hand in hand with other partners to train staffs in other lower levels, such that these backlogs can be dispensed into those other centers, such that the matter is addressed. Thanks.
Thank you. Yes, please.
Somebody who has undergone the so-called mental health we're talking about. And my colleagues, I want to tell you, this is a pandemic for now. I want to go straight to my prayers to call the government to have quick response, like whatever they're doing to Ebola. Because many people running mad is okay for the government. I am calling the government to take action by putting more centers for the mental health treatment. Then secondly, is the courts of law. I will put this that instead of the prisons, the right place is psychosocial support centers. Instead of overflooding our prison centers, the police and the judiciary should also be calling on all parents. Just as somebody said, Suso, yesterday, and somebody was thinking of getting something from you. Parents also know that graduating from school is not like getting money automatically. So we call all the parents to understand the children and also give them time to stabilize as they keep to support the family.
Thank you so much. Aldo, do we have a person? Thank you very much for all those deliberations. I'm so impressed at how vivid the conversation is moving on. So now I would invite the clerk to help us invite the motion mover to give us a summary of what he has at hand.
Thank you, Madam Speaker, honorable colleagues. I also want to appreciate your contributions. I saw at one point it got heated. That's how mental issues are discussed. And it's not to blame anybody because it affects us and people always say about emotion about them. And we want to appreciate all your contributions and they are also been incorporated. And here are some that I have captured and others are inside it. Is our prayer that our prayers are here. One, we have mental health screening, counseling, and referral services at health centers and most of those places where health services are offered. We have already talked about issues to do with the government delivering free loans to interest-free loans to youths programs. Then you talk about fairness in delivery government programs that has been captured. Then talk about the police engagements in some of these issues that have been captured. Then the youth-friendly counseling and social support programs. I know there are a lot of the government, some NGOs, that private sector is doing that, and things also deliberate that we need to do. And the Arua city also need to be deliberate in these 5 years that we have some of these services. Then the public awareness campaigns. This we can do, honorable members. You can, through our social medias, TikToks, WhatsApp, all the platforms, or also engage in the community level. We can do awareness sessions. Then all community youth parliament sittings and youth councils, we need to also integrate some of this into our sittings, so that we have, if necessary, bring experts to support in some of these programs. Government recruitment and deployment. That there's a minimum of 2 mental health professional, psychiatry, nurses per district. Because one of the issues is that we have few people, technical people, in that area. So there's need, even Arua City, to employ in the next adverts. We need to see that they employ many of those health workers. And then it's our role as the leaders to advocate. Digital platforms. Now, most of us, is a digital era, and let us make use of it so that we make awareness and make campaigns. And there's many of you online. I think only few, apart from my grandmother who's not online, who's still, I'm still trying to empower her that she also gets online. Then special focus and affirmative actions be granted for vulnerable youths, including young women and in unemployment youth disabilities. So, Honorable Speaker, Madam Honorable Speaker, I think due to also time, I beg to stop here. This is our prayers, and it's our prayer that these things were deliberated don't just stop here, and they're able to move to Arua City Council, later to the National Assembly, that something can be done in terms of policy, in terms of deliberate actions. Thanks so much. I beg to leave.
Sorry for that. Thank you so much for that. You've submitted, right? Thank you. Now, I would wish to say we will put that in practice. We will make sure that whatever information that is deliberated here, we would be able to submit it to the high authorities. I think I've answered that.
Thank you. I think that's 1 minute. I think I may not speak again now. Allow me take this opportunity to thank Host Hub and the entire Youth Council, the leaders, for making this possible. I think one of our pledge as the civil society is to work together and see that we look for more resources, that these engagements together with the Youth Council, that we're able to push this council, this sitting doesn't stop here, that we're able to look for more resources, that we have most of these sittings. Thanks so much.
Thank you so much for that elaborate talk. And as I said, as the speaker and my other colleague would make sure that this information reaches where it is supposed to reach. We'll try our best and do that. In the platforms that we get, whatever platform that we have, this information will be able to avail. So, thank you very much. We've come to the end of our discussions, and I would wish to thank each and every one of you for your vivid participation. It is always said, we disagree to agree. So, we disagree to get better solutions to our problems. In the course of our discussions, if one or two things didn't go well, please, let's take it in a positive way. Positive feedback is very important for us. Without it, we will not grow. So wherever we are in a sitting, please, let's take feedbacks positively. If I also did something wrong in the course of the discussions, I would take it positively if you tell me. As I said previously, we are ready to learn, we unlearn, and we relearn every time. Because sometimes you feel you know this, but at the end of the day, you realize that someone has a better alternative. So you unlearn what you have learned, and you relearn again. So I would wish to appreciate each and every one of us. Each and every one of us for the work well done, for all your voices, your opinions. I loved the discussions. Please give an applause to yourself. Tap your back. Appreciate yourself. That is very important. We call it self-care. Okay. So before I adjourn the sitting, we are going to invite the duty bearers to say one or two. Please, let's keep time so that we don't have any issues again concerning time. I'm giving each of you 5 minutes. So that, since we are summarizing, please, let's follow time. You're welcome.
Thank you once again, Madam Honorable Speaker. On the podium, to elaborate on few. First and foremost, I want to thank the organizers for today's sitting. It has been a good one, and good things come with challenges. The challenges we face today are the corrections we're making tomorrow. 2 or 3 have exchanged words, either verbally or they use their mind, which has also contributed to their mental problem. The mental problem, or the mental health thing we're talking about, it's not government, it's not me, it's not the parliament, but it comes in the form of a question. I would like to say, take back to your families. Where are you coming from? As you are growing, how are you guided? If I told you you grew from a responsible family, how are you guided? As you who are growing up to become parents, or those who are already parents, one thing we need to know is the kids we have at home are the pillars of tomorrow. If you over restrict your child, from gatherings, from engagements, I dare you that tomorrow the child may have a mental health issue. Take an example. You have restricted this child from playing with the others. Any slight mistake, your hands on him or her. He's always in cries. He's not happy. You are sleeping, he's with eyes open, thinking, if I grow up, I will want to do things I was restricted from. That's why I see tomorrow, we see the youngs, they're already in the drugs. Because they didn't know in their youth stages or early stages, these are things to their lives. They want to try because others are already in it. If we continue saying government, 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 will government go and organize your home? It's a question. If they're not going to be organized from your homes,
you find people like this graph is very so we are to more different practice and always natural. We need to understand how you flat everything.
Back on the point. In fact, let me just go for my prayers for tomorrow's success. One, let's support our homes before we come to the community. As you leave your home, know that there is always return back. So when you move home, back, move as a changed person. Learn something from outside, you go back, inspire the rest from home. Always have stories to tell others. If you booze, have that story and tell your kids that when I was in such a school, I used to jump over the fence, I was caught, I was expelled from school. When OC is moving out to do same, you'll have that in the mind. That once daddy told me, I jumped over the fence, I was caught, I was expelled, they didn't pay me back. And if I do this, the same may happen to me. Dad may want to pay back to me. You'll have that fear, or you'll have that fear. If you prepare someone like that, you may not have complaints that government is doing ABC, government is not doing that. Because government operates in a protocol. You apply it today, you get it tomorrow, not immediately. But when you talk to someone, you can get the result immediately. Two, identify good role models. If someone has a talent, allow that person to go for the talent. The person can sing, allow him to sing, allow her to sing. Allow the person to dance. Because that can bring in money for the person, rather than making the person to be failing, repeating the same class. Then if you allow someone to take up his or her role, how will that person be affected mentally? The person will have happiness, rather than pushing and forcing the person to do something. Engage youth in creative activities. We already have academies. People are training youths in different things. Allow them to go. Holidays, allow them to go rather than staying home. It's not that only reading makes someone to pass, but learning from others, from their peers, makes someone to prosper. I talked about restrictions. Don't.
Please
I
summarize.
repeat, don't. All in all, as Arua City, We're here to support in all the kinds that we can afford. I'm not going to place that we are going to do A, B, C, D tomorrow, but timely by the reports we are going to prepare and we submit to the rightful person, all will be understood and worked for. As we are going to leave back our places, our homes, I pray for journey messes. I wish to say happy weekend to all of us. Enjoy our time. Thank you.
Thank you. Let's have the next duty bearer to give us a word or two.
Yeah, thank you, Right Honorable Speaker and the August House. I want to begin by saying this, and it's a common quote that people have been using, that a lot is going through people, and people are going through a lot. And when you understand that statement, you will really know what it means to have a mental well-being. Many of us were deliberating in the beginning, we didn't understand what it means to have a good mental well-being. Many of us attached it to madness, but it's not. So, Right Honorable Speaker, before I submit, I would want to request that you give me more minutes, more than 5.
How many more minutes? Be specific. Thank you.
I can conclusively give a remark on behalf of the town clerk, so that when you adjourn, you know you are adjourning when the town clerk has given remarks.
How many more minutes do you need?
I would request 7, and I'm already timing myself. So,
I'm giving you 10 minutes in total.
Yes, it's okay. I would appreciate that. Now, what do we understand by mental well-being? It is more than just. It's about coping up. It's about what you go through in daily life. And what are these things that affect our mental well-being? One, we have dropout from school or employment. It is so common when someone loses a job, you can see the frustration in someone. And when a person is frustrated, that means the mental, the well-being of that person is affected. And it happens when someone drops out of school, and yet the person would wish to. Then secondly, increasing substance abuse. And these are all drivers of mental well-being. And when all this happen, you'll find someone is depressed, someone is stressed, and someone cannot think well, and someone cannot perform. Now, what are we doing as the council? One, we have integrated all our mental well-being, also issues into the primary health care, and we have also incorporated it in schools. When you look at the national plan, and when you look at the curriculum that has been developed at lower level, you'll find that it is integrated. So that is one of the things that we're doing. Then secondly, in our facilities, we have counselors counselors are meaning those who do guidance and counseling. They are there in our facilities, but people are not using them. And people only refer to them, I would wish to quote this, people would refer to them people who assist persons with HIV. No. They are there for us. They are not there for persons living with HIV. So let us not look at them as people who are there for HIV, but they are for everyone. Then we have been doing awareness. But of course, someone's mental well-being keeps changing every day. Today you're okay, you're fine. Tomorrow, something disturbs your mind and you'll not live well. So that one, we have equally been doing. Then, we have equally integrated, like for this coming financial year and this running financial year and the previous financial years that we have been operating on, we have been integrating awareness into our budget and planning. So that means every time staffs go out, awareness does not mean we go and organize campaigns, barazas and all those, but it's about educating someone and someone getting to know the importance. So, what are these pillars and actions that we have equally been taking? One, when you look at prevention, we're supposed to prevent this at onset. One of the pillars that gives us strength is having prevention, and this has been, the actions have been through schools training and awareness campaigns. Then you realize that early support is also key. Early support in a sense that we have youth-friendly counseling and guidance. We have mentors. We have someone who encourages you and all those. So when we do all this at an early stage, then we'll be good to go. But now, when this reaches an advanced stage, now to an extent that someone has gone mad and someone's well-being cannot be done in a way that has been expected. So we now go into treatment to ensure that, just like the way our colleagues are saying, we employ psychiatric nurses and all those. Those ones are to treat. But before they treat, there are actions we are supposed to do before as listed, that are listed. So equally, we are also providing safe space, especially sports and mentorship. But I want to ask the August House, Right Honorable Speaker, do we even know that as a city we have a youth space? Do we know that? And how many of you have accessed that place for the last financial year or for the last 1 year? I think I was deliberating with my colleague that we need to have attendance register at the gate, that every honorable member here should register upon visiting the youth space. But we have totally abandoned that, and it has been left there for people, for someone older than, someone who is above the youthful age. So I implore that we take interest in that and take into consideration. Now, there are warning signs that you would really see someone's mental well-being has been affected. There are warning signs. And what are these warning signs? We have persistent sadness. You see someone is really sad, and truly you will know. Right Honorable Speaker, as one of the honorable members was submitting, I was looking at your mental well-being when the debate became intense. So that means that was just for fun anyway. But sadness and drop in performance, especially for someone who is working. Definitely, you know someone's performance has been affected, and the mind, you really see the mind is not there. The family issues and all those. Now, what are we going to do when we realize some of these signs? We need to encourage such a person. We should not run to police when you see someone sad. We should not run to labor office or the social and welfare officer. But we can start this at an onset, encourage the person so that the person lives a dignified life. But the bottom line is, mental health services is now recognized as part of youth development. So all youth activities and all activities that are meant for youth and other programs are tailored in a way that they handle youth-related issues. Now, Speaker, that has been my submission on that item. But as I conclude, I want to say, as a city, we have a budget that has been, we have monies actually that has been allocated for youth activities. And I would wish to implore that all honorable members in the August House take a keen interest to understand how these monies are spent and how city had planned for them. And how are you going to pick interest in that? We have our representatives in the council. That is Mr. Honorable Magezi and a colleague there. Put them into task to see that the youth fund or monies allocated for youth activities are put into the right use. Now, conclusively, as a city, we remain committed in serving the youth, and we will do our best to ensure that all deliberations and all items that needs to be included in our planning, we will do them. And those which we cannot, we will leave them for the subsequent years to come. Of course, we cannot implement everything. Government has a lot of programs and a lot of priorities. We have got priorities in health, we have got priorities in education and production. Recently, production has become a major issue. We have roads in engineering and all those things are priorities to the city. So, for us to best implement this, we will do a systematic planning, and through our honorable councillors representing the youth into the council, we will also see that we prioritize initiatives and youth activities. So, Right Honorable Speaker, with all this, I wish to submit and thank all honorable members for the deliberation, and I wish you safe journey and safe stay out.
Thank you. Thank you so much for those commitments and all you have said. As we come to the close, I was able to come up with a summary of what we were able to deliberate here. And overall, we are looking at system strengthening, because most of the discussions that came in, we are looking at strengthening the different systems, especially in the hospitals, police, the different systems of the government, the CSOs, and the other private sectors. So that is one of the issues. And then we also looked at issues of inclusivity, especially the persons with disability. And then we also looked at the cry was for incentives for the youth, especially in the different sectors. And then there was a cry, a prayer for innovation centers or hubs to be established in the city. And then we also prayed that would be able to sensitize the communities more and more in the different avenues and platforms that we have. And lastly, we are looking at empowerment of the youth through the different ways. That is a summary of what we were able to discuss in this sitting. And I would pledge, as the office of the speaker, that we would be able to sit down with my other team to discuss how best we can forward the issues that have been discussed in this sitting. And I also call forth the youth leaders that we have, especially in the city council and other platforms. Please do your best. You've been here, you're part of the youth. Raise the voices, advocate for the youth in all the sittings and platforms that you have. As we, who are also here in this room, please, whatever avenues you have, I know some of you are leaders in your community, even in your family, you're a leader. Advocate, push for something so that we get better youths tomorrow. Thank you so much. And before I adjourn, I would invite our organizers to give us a concluding word before I adjourn the sitting. Thank you.
Honorable members, in this respected community youth parliament, good afternoon to you all. My name is Nadia Idi Hassan, your commissioner for today's activity. I want to thank you all for participating and for being very proactive throughout the discussions up to now. However, I want to give you a small history about me. For those of you who don't know me, I am a female councillor representing the women of Awindiri Ward to Arua Central Division. It's my second term of holding office. And this does not only come out of blue, it comes from such opportunities that are given. I am one of the pioneers of the National Youth Parliament that happened in 2018. And it is through such kind of platforms that have shaped me to becoming what I am today. I am able to make decisions on behalf of young girls, on behalf of women, on behalf of youth, whom we all know are marginalized in a lot of aspects, specifically in development and decision making. So once you're given such kind of opportunities, honorable members, use them very carefully. That's the only advice I can give you. And also want to give you one thing. You should know that the sovereignty bill that has been passed, be extremely careful. 5 years from now, we don't know whether we shall be having such kind of opportunities. So the little you're already having, maximize it. Use it to the best of your knowledge. Seek for more knowledge. And localize your knowledge, by the way. Some of us are sitting on talent, on knowledge, because we feel like, I'll do it next time. If you don't use this time now very well, remember your age is running very fast. Some 4 years to come, some 5 years to come, some of you no longer will be youth. Will now be either senior youth or just an adult. Let me use that statement of adult. There you'll have a lot of responsibilities. You want to build a home, you want to do what. So those things come as you age. So for now, as you're still young, use this opportunity very well. Today, some of us are speaking to you. My brother Aldo has given you guys an opportunity that has never been existing in Arua. My honorable members, I want to tell you that we have been part of these platforms like the way you are today, but they've been using us a lot. They use our knowledge, they use our energy, they use our innovations. But today, our fellow youth has come up with such an idea. Let's clap for him. He really deserves it. He's empowering you to become better so that you change our community. And if you take this for granted, Arua City will still remain behind. We are all complaining that there's no employment. Which innovation or innovative ideas have you come up with as a young person? Look back at your communities. Just take a look at your community. What is lacking there? That you can change yourself. Let's hold our hands together and build a brighter city, a very innovative city. And thank God that we're having a youthful mayor. A mayor who will listen to us, a mayor who will implement our ideas. But then that should not make us relax. Let's work extra hard so that we have host hubs, even other hubs, just like the way our brother Aldo is having today. We can even have more of such. He's having a hub that has innovations of ICT. You can also have a hub that has medical innovations, online clinics. Nowadays, the world is going digital. And we can use our digital skills to make sure we develop Arua. And we can do that, by the way. It's a matter of holding hands. I hold hands with you. We start out on something. Honorable members, as I conclude, I want you to know that we cannot be empathetic to ourselves. We cannot be silent. And we cannot sit back. It's high time we wake up, we use our knowledge, we participate, we contribute, and we make a brighter Arua city. To my local government leaders present, I request to create platforms that young people can access for doing consultations, for sharing information, for sharing ideas. And I also ask you to be very intentional in helping the young people, in supporting their innovations if they come to your office. Be very intentional in supporting the young people, the young generation in Arua City. To the civil society organizations like Host Hub, like I saw Seftra Win, I saw Hope Foundation. As I saw, let's continue training our young people. We train them, we give them the skills, we give them the knowledge. Let's not get tired because we are, I want to use a local language, we are members, we are wears. Without us, there will be no greater West Nile. And West Nile only comes in when it is me and you developing it. And for you as the young person, wake up from the comfort zone. Let's rise. In the next 5 years, let's be a better us in Arua City. Thank you for listening. As I close, I think I call the senior commissioner, Abbas, to come and close and give us administrative announcement, I think. You're welcome.
Yes, thank you, ladies and gentlemen. It has been a wonderful day for us today here at the day was long since yesterday. We began here by 4 p.m. yesterday by arranging the room, making sure everything goes well. And we give great thanks to Almighty for helping us and allowing us for the day to go successful. I want to thank all of you for listening to our call, for giving us your time, for attending the Youth Parliament. As my colleague commissioner said, I've come for the administrative announcements. I hope by now everyone has registered at my desk there, both attendance and payment sheet. If the network is okay, before close of business today, you'll receive a message, something small for today, for coming year. So our next Youth Parliament will be 7th of next month, that is June. Luckily, it will be a Saturday. In that same Youth Parliament, you will be awarded your certificates for attending the one of today. Due to the constraint of time, today we couldn't process the certificates in time. So we shall use the attendance sheets you registered in today to generate your certificates for which you'll receive in the next Youth Parliament. Before we adjourn, or after the adjournment, I request all of us to step out for a group photo after the speaker's adjournment. Thank you very much.
Thank you, Abbas, for that. And now, as we go out of here, let's keep in mind that we are going to advocate against mental health issues. We're going to advocate against drug abuse, misuse. We are going to advocate against youth unemployment. And we are going to advocate on issues to do with civic participation of the youth in the different platforms. So please, let's all put our hands on deck. Advocacy is not a one-man's thing. We need everyone to advocate. It is a collective effort of each and everyone. Everyone is important for us to push this agenda forward. With all that said and done, I would invite one person who has been moved by the Spirit to pray for us before I adjourn. Thank you so much. And with that, our first youth parliament has been adjourned. Rise.
Let us Hello everyone.
My name is Sophia.
And my name is Marcus.
And we are speaking to you on behalf of the Danish Network of Local Youth Councils.
First of all, let us send you the warmest greetings to all of you in the Community Youth Parliament. We are super excited to be cooperating with the Network for Active Citizens. It's truly inspiring to see all their efforts to strengthen youth involvement in Uganda.
Even though we all come from different contexts, we believe that we are not only the leaders of tomorrow, but also the leaders of today.
Through the Community Youth Parliament, you are creating spaces where young people can meet and influence the decisions that affect your communities. This is just like what we do with the local youth councils in Denmark. This is important.
Youth involvement is crucial to bring new perspectives, energy and ideas to the table. We are so excited to strengthen this partnership and continue working together in the following years.
Tusind tak!
Attention Ugandans! Ebola is a dangerous but preventable disease. Watch for symptoms such as fever, weakness, vomiting, diarrhea, stomach pain and bleeding. If someone shows signs of Ebola, avoid physical contact. Do not touch bodily fluids. Report the case to health authorities immediately. Protect yourself by washing hands regularly, avoiding contact with sick people and following Ministry of Health guidelines. Early reporting saves lives. Stay alert, stay safe and protect Uganda. This
Introducing Host TV, your ultimate advertising destination. Get 50% discount offer today. Elevate your brand with Host TV. Available on YOTV, Afro Mobile and Host Media app. We offer commercial advertising, live event broadcasting, streaming service, social media marketing, publication on dailywestnile.info. We are Host TV. Connect with us on all social media platforms. Host TV, exploring.
Looking for top quality uniforms, corporate wear or custom printing that speaks excellence? Welcome to West Nile Garment and Printing Service Limited. We specialize in school uniforms, corporate attire, protective wear, embroidery and screen printing, all crafted with precision, passion and durability you can trust. At West Nile Garment, every stitch tells your story. Because your brand deserves the best, visit us today at Pro 35, Third House, Rhino Camp Road or call 0392 548 308. West Nile Garment and Printing. Brand better, dress smart, print quality.
Every child deserves a chance at life. But malaria still claims the lives of many children every day. This doesn't have to be the case. The good news is, starting this April, you can protect your child with the new malaria vaccine to reduce the risks of severe malaria and possible death. And when combined with a mosquito-treated net and other malaria preventive measures, it offers even stronger protection. Make sure your child gets their first malaria vaccine dose at 6 months and completes the remaining doses by their second-year birthday. This vaccine is now part of your child's routine immunization schedule and is as essential as completing all other childhood vaccines, such as those for measles, polio, and yellow fever within the first 2 years. Give your child a chance at life by visiting your nearest health facility, offering vaccination and immunization services to protect your child against all immunizable diseases.
Gaga your way to Morocco with Uganda Cranes and MTN. Simply buy a Gaga bundle by dialing *100 *0# and stand a chance to win a fully paid trip to Morocco. Gaga your way to Morocco with Uganda Cranes and MTN. Together, our fire is unstoppable. Fire! MTN. Terms and conditions apply. MTN Uganda is regulated by Uganda Communications Commission. Miss the headlines? Afro Mobile brings you live TV on the go. Stay updated with the latest news, sports, and entertainment wherever you are. Afro Mobile is like carrying